Assistant Professor, SNS College of Pharmacy and Health Science, Coimbatore. Today we are going to discuss the physiological factors affecting the drug absorption. So first we want to see what are the physiological factors that are going to affect the drug absorption. So drug absorption is the process by which drug move from its site of administration to systemic circulation. So the drug absorption is nothing when we take the drug in orally, how it enter into the body and it enter into the bloodstream. The systemic circulation is nothing but the bloodstream, from the body to the bloodstream. How to it enter into the body to the bloodstream is the study of drug absorption. This process can be occurred due to the various mechanism. The absorption process can be occurred due to the various mechanism, that is a passive diffusion and active transport and facilitated diffusion and endocytosis. There are different processes of the drug absorption. Okay. Next, classification of physiological factors. So the various classification of physiological factors that affect the drug absorption. So physiological factors affect the drug absorption are broadly classified into the following. So there are the 10 factors which affect the drug absorption. Today we are going to see the 5 factors. Okay, first 5 factors. First one is the factors related to the gastrointestinal tract and factor related to the blood flow and circulation. So how it affects the blood flow and circulation, and membrane permeability and surface area, and pH and ionization. How pH and ionization which affect the drug absorption and enzymatic activity. Okay. So first we can see the gastrointestinal tract, how it affect the drug absorption. So gastrointestinal tract is one of the common site for the drug absorption. All type of like tablet, capsule, syrup and all type of most of the drugs are get absorbed in the gastrointestinal tract, especially for oral administration of the drug. Several physiological conditions which can be affect the GI tract influence how body effectively drug absorption. Okay, so how drug effectively absorbed can be prevented by the gastrointestinal tract. Okay, so first gastric emptying time. So gastric emptying time is nothing that refers to the time taken to the food or drug to move from the stomach to the small intestine. So how when we take the drug or food, how it reach, first it reach from to the stomach, then it reach to the small intestine. From the stomach to the small intestine, that contact time, the reaching time to the stomach to intestine is known as gastric emptying time. Since most of the drugs are absorbed in the small intestine, so most of the drugs, even the food the content, the nutrients are absorbed in the small intestine in the villi region. So most of the drugs are also absorbed in the intestine region. So the faster gastric emptying usually enhances the absorption. So if the drug will be faster emptying from the gastric region, have produced the better gastric absorption. So the gastric emptying is delayed. If the gastric emptying is delayed, the drug remains stayed in the stomach region. The stomach region, if it is prolonged in the stomach region, the stomach contains acidic environment. So the drug can be easily sorted to degradation. So degrade. So the effect of drug can be less. So the effect of therapeutic effect can be reduced. So that type of acid sensitive drugs can be avoid the delaying of gastric emptying time. So increase the absorption rate but also reduce the contact time. And next on the intestinal motility. So how intestines are motile. So if the intestinal motility is in the correct rate, then we only have the proper intestinal movements. Okay. So intestinal motility refers to the movement of content in the intestine. So movement of content in the intestine. How intestine have proper movement, then the drug can be easily absorbed. Okay, so if the intestinal movement is there is a fast intestinal movement, the drug absorption can be reduced. If the intestinal movement is too slow, the absorption can be more frequently and more effectively done. So we can see here the increased motility reduce the time availability of the drug absorption. So increased motility reduce the time availability of the drug absorption, where decreased motility increase the contact time of the absorption. In several cases of diarrhea, so if you have diarrhea, there is a faster intestinal motility movement. So the drug absorption can be reduced. In some type of like constipation, there is drug is deposited in the intestine, and the intestine motility can be slow. So the drug can be easily absorbed through the intestine. So surface area of the intestine. Next factors is the surface area of the intestine. A small intestine can be larger surface area. The small intestine have larger surface area due to the presence of villi and microvilli. The small intestine contains which has the microvilli and villi, which is responsible for the absorption of food and drugs. This is the extensive surface area which enhances the drug absorption. The extensive surface area which increases the drug absorption. Any condition which reduce the surface area, if any condition or the surgery which reduce the surface area, which decrease the drug absorption. So any condition that reduce the surface area, such as surgically remove the part of the intestine. So if intestine have any cancer or something, they surgically remove the intestine, then the surface area of the intestine is reduced. So like so the absorption is reduced. So like a celiac disease and significantly reduce the absorption. Okay. And next the pH and ionization. This is the important. So pH is in the different region of the body affect. So in our body, in different region have the different pH. So that pH can be affect the drug absorption. So body affect the drug absorption by influencing the ionization state of the drug. The stomach has the acidic pH. We already know the stomach has HCl, so it is an acidic pH. While intestine is a more alkaline. So intestine is a more alkaline. Drug exists in ionized or non-ionized form of depend on the pH. So if the drug is the acidic drug which absorbed in the alkaline region, which is the intestine region, if the drug is basic which absorbed in the stomach region, which is highly acidic pH. So for example, weak acid is better absorbed in the acid environment. If the drug have weak acid, the drug is easily absorbed in the acidic environment. At the same time, if the drug is have the weak base, it have better absorption in the alkaline environment. So it's absorbed in the weak bases are absorbed in the stomach intestinal region. Okay. Next, blood flow and perfusion. If the blood flow is the proper in our body, our intestine, the absorption of the drug is increased. So higher blood flow maintain the concentration of the gradient. The higher blood flow increase the concentration of the gradient, which is facilitated to conduce the absorption. The lower blood flow reduce the rate of absorption. There is nothing. The lower blood flow which reduce the rate of drug absorption. For intense inhalation of aerosol delivery drug directly into the lungs. So for if we have the wheezing or a wheezing problem, we can inhale the drug through the aerosol route, aerosol region, aerosol products. So the aerosol can be taken throughout the mouth and directly enter into the lungs. So that area, the lungs area have higher blood flow. So the drug can be easily absorbed. The aerosol drug can be easily absorbed and produce their therapeutic effect. Okay. And also intramuscular injection absorbs faster. So also intramuscular injection also which work faster because it does not enter into the stomach for the absorption. So there is no problem related to the blood flow and perfusion in the intramuscular region. Next, membrane permeability. The biological membranes are primarily composed of lipid bilayers. The ability of the drug cross the membrane depend upon the physiochemical properties. So the lipid soluble drugs are readily across the cell membrane. So the lipid soluble drugs are readily cross the membrane, where the water soluble drugs are required the transport mechanism. So water soluble, lipid soluble drugs are easily cross the cell membrane, but the lipid soluble membrane drug soluble drug which need the transport mechanism. So membrane permeability can be different from the various part of body. For example, intestinal epithelium have high permeability compared to the skin. So intestinal permeability have high permeability compared to the skin. If we have applied the skin, for example, if we apply the skin in the drug in the skin, which can be have the slow absorption when compared with the intestine. So intestine have the faster absorption than the skin. So these are the topic we covered, the physiochemical properties of the drug absorption. So remaining topics are covered in the next video, and thank you for watching. Have a great day.